What a week last week was, and it looks like this one might be even more eventful. Welcome to your Monday Healthcare Briefing. I'm here to catch you up on the headlines from last week so you can hit the ground running. If there's anything you would like me to dive deeper into in my Friday updates, please let me know ahead of time and consider research, but for free. Also, Maverick Health Policy held their quarterly webinar last week, and I'll be recapping the highlights at the end of today's update. So stick around for that or skip ahead if you're pressed for time. Okay, let's kick things off with a shout out to all the physicians out there. It was National Doctor Appreciation Day last week, so thank you for everything you do to keep us healthy and supported when we need it most. Now, HHS. After laying off roughly 10,000 employees last week, Secretary Kennedy acknowledged last Thursday that some of those cuts were mistakes, saying, quote, personnel that should not have been cut were cut. We are reinstating them. That was always the plan, end quote. So HHS is in what I would call a stage of oscillations. Whether you're for or against the changes, we're all going to feel the ripple effects. We'll keep tabs on what's working and what isn't as the dust settles. Okay, we can't talk about HHS without talking about Medicare and Medicaid. CMS announced that weight loss drugs like Ozempic won't be covered, which they say will save $35 billion over the next decade. On the budget front, the Senate passed Concurrent Resolution 14 early Saturday morning, setting the stage for the fiscal year 2025 budget through 2034. While it supports a fast-track timeline, it's really more of a placeholder, giving both chambers some breathing room while they work through major differences. And let's be honest, finding a way to balance the budget without making cuts to programs like Medicaid is going to take some serious creative thinking. That creativity will be put to the test, especially after last week's report from the Nonpartisan Committee for a Responsible Federal Budget, which estimates that the Senate's resolution could add $5.8 trillion to the primary deficit. So, on to Medicaid expansion and the ACA. All of this puts extra pressure on state leaders because if cuts to Medicaid expansion happen, someone's going to have to pick up the slack. And that someone might be the states. According to the Kaiser Family Foundation, the Affordable Care Act hit its highest favorability rating ever this January at 65%. So any change that chips away at it is going to get noticed. Some states like Missouri, South Dakota, and Oklahoma have constitutional mandates requiring Medicaid expansion. If federal funding disappears, they're still on the hook unless they change their constitutions. Meanwhile, states like Arizona, Arkansas, Indiana, and a handful of others have trigger laws that would end expansion the moment federal support is pulled. Every state will need to decide how to respond and what their choices mean for their budgets, their constituents' health care, and their own political futures. Let's pivot to tariffs and the economy. We talked about this last week, but here's where we are now. As of today, the U.S. has officially entered bear market territory. Trump's team is calling this medicine before the prosperity. But even short-term pain can hit hard, especially when it comes to programs like Medicaid. It's not hard to connect the dots here. Tariffs could drive up healthcare costs, funding cuts could limit access, and a downturn could reduce people's ability to afford care. That's a recipe for serious stress across the system. And when you add it all up, this list of side effects from this economic medicine is pretty long. Let's hope we can avoid the ones that land us in the national equivalent of an ER. Okay, now let's get into Maverick's quarterly webinar. I've been a longtime customer, and they've been an invaluable resource for understanding federal healthcare policy. If you haven't signed up for their free newsletter yet, I highly recommend it. And just to be clear, they don't sponsor me. I actually pay them for their service. Okay, here's a quick recap of what stood out. Julie Barnes and her team made it clear we're seeing a major transfer of responsibility from the federal government to the private sector. With fewer federal staff and less institutional memory, getting answers or guidance will be harder and slower. That's a real risk for industries dependent on federal leadership, especially in areas like health data privacy and exchange. Now, on to leadership changes. There is still a lot of uncertainty about the future of ASTP, ONC, and Steve Posnack. Some rumors suggest ONC could be absorbed into CMS. In other leadership updates, FDA and NIH have confirmed new appointees. Dr. Oz has been nominated to lead CMS. Jim O'Neill, hey Jim, is up for Deputy Secretary of HHS. Susan Monteras has been tapped to lead the CDC. Clark Minor, the HHS CIO, is actually reportedly taking charge of AI. And Chris Klomp could lead the Center for Medicare if confirmed. The Make America Healthy Again Commission is taking a broad look at chronic disease. They're analyzing not just medical care, but also things like nutrition, tech habits, environmental exposures, and medication reliance. The first 100 days are focused on reviewing existing research, identifying knowledge gaps, and comparing global outcomes. They'll deliver a report to the president soon, and you can bet we'll cover it here. Now, price transparency. Yes, this one's personal for me. Price transparency is getting attention again. The new administration's executive order pushes for stricter enforcement and clearer data standards. It's already bringing tools like the Castlight Help app Castlight Health app back into play, originally designed to help consumers compare costs and quality. I'll be highlighting price transparency in at least one video per week going forward. Oh, and a quick side note, the GOP's request for input on National Data Privacy Framework wraps up today. So if you've got thoughts, now's the time to share them. And of course, AI, specifically state level AI legislation. States are charging ahead of the federal government when it comes to regulating AI, especially high risk AI used in healthcare. Colorado led the way, and others are catching up. North Carolina even has a proposal to regulate AI chatbots. The language is still pretty murky. The risk overall here is ending up with a patchwork of state laws that make compliance a nightmare for national organizations. So, this was just the surface of Maverick's webinar. If any of these topics interest you, definitely check out Maverick's website for more. And that's your Monday healthcare briefing. Let me know if you'd like me to cover anything in Friday's update, and thanks again for checking and clicking in.